Hey everyone, today I'm going to run you through a full body massage or just loosening up, a bit of soft tissue work at home. All you need is a ball. When it comes to balls for massage, the firmer the better. You don't need a really expensive massage ball. It can just be a really firm tennis ball, but even better, something like a cricket ball, baseball, or what I've got here is a lacrosse ball. You can get these for quite cheap online. So today I'm going to run you through just massaging out the body. We're going to start in the arms, working up to the neck and then down through the body. If there's a particular point you want to massage out at home, you can skip ahead in the video and try to find that. But that's kind of the route we'll be taking, up the arm and then down the body. So I'm just going to start by getting into the forearm muscles. Really good if you have wrist pain or tennis golfer's elbow. Just grabbing your ball, placing it on the ground or table. Put this part of your arm there and rolling up and down like that. When you're doing soft tissue work, if you come across a particularly tender spot, you can keep rolling over there to try and loosen up specifically. Try to avoid going across the joint line as well. So you're not rolling on top of the bones, just through the muscles. I like to use this hand to apply a bit more pressure down to really get into my forearm flexors. I'm going to swap sides, same thing other side. Forearm down, pressing down as I roll up and down, finding any particularly tight spots and getting through there. When you're rolling out, you can go essentially for as long as you want, as long as it feels nice. What I usually do by a rule of thumb is either up and down like this 10 times or just go for about 30 seconds if you prefer to do it timed. If you want to do for longer, even better. Now we're going to get into the other side of the forearm, so the extensor muscles up here. This one's a bit more awkward. You're going to roll your hand out to get the outside of the forearm facing down like that. You might end up having to get your arm in a slightly awkward position like this. Once again, I like to push down with the other hand to really get in there. That's really tender through there for me. Same on the other side, forearm down, rolling up and down. Coming out there. Now, we're going to come up into the chest. So often we get tight through the pecs because we're constantly sitting in that slightly forward position. 99% of the people I meet are rolled forward slightly, especially people that do a lot of work in this position, whether it be office work, manual labour, or even just someone that goes to the gym a lot. So tightness there actually contributes to pulling your shoulder forward. So this one's good to get in if you have a bit of shoulder pain as well. So this one, you find your collarbone, comes slightly down, there's a bit of a ditch just on the inside of your arm and collarbone. So you get the ball, you can do this on the wall or the ground. You put it in that spot, lean into it and then just gently move around there. I get really tender in here. And do the same on the other side. So once again, just under the collarbone, on the inside of your arm, and just sitting there like that, and then pressing it down into the ground or wall. Looks a bit funny, almost like you're hugging the ground, but it's quite good to get in there. Now we're going to come onto our sides, getting into the deltoids this time, this part of the shoulder. So just putting the ball down, leaning that part onto it, and you can just gently move around there. It's a common area for shoulder pain when it gets referred down from slightly higher up. Just keep in mind that these methods are not an adjunct to medical treatment. So if you do have pain or particular injuries, I recommend you get them checked out by your local therapist. Now while we're here, before we go on to the other side, we're just going to roll back and get into this part. So a few muscles that run through the shoulder, we're just aiming pretty much to put the ball around the shoulder blade, coming up to the back of the shoulder and right down into the lower part of your shoulder blade. I find it easiest to get there by reaching under the other arm, placing it there, and then rolling onto it. Where you have your arms up to you, can be out to the side. I just cross my arms and relax them to get them out of the way. This is another point that can be particularly tender. I get really tight through here, just because I use my arms a lot. So I find this one really helpful. You can also do this leaning against the wall and it's not quite as intense. You might move around after you've kind of worked on one spot for a bit. And that bit's actually referring a bit of discomfort down here for me, just because it's so tight. Now, grabbing your ball, we're going to come to the other side. So getting into the deltoid here, placing the ball down, just landing on it, then moving around. I like to use my other arm to support, take a bit of the weight. If any of these are too hard for you, you can skip any particular muscles and just do a few of them. You might find some really helpful and you utilise them ongoing. You might find some don't really do anything. That's fine. We're all slightly different. Now once again, coming back into this shoulder blade area, reaching the ball under, placing it there as you roll onto it. Find a tender spot, you might move around there for a bit, loosening it up. And then you might move around, find another spot. Oh, there's a good spot. With these, if you're moving around, you don't feel anything, you're probably not that tight through the muscle, or you might just keep searching different areas of the muscle. If you don't feel anything, there's probably not going to be that much benefit. All right, and letting go. Now, grabbing the ball, we're going to do the back of the neck. With the neck, if you want to do it really well, you get two balls the same, put them next to each other like that so they're touching, and tape them together. That gives you a slight ridge in the middle, perfect to just lie back on, with the concave part allowing your spine to sit comfortably. Unfortunately, I don't have that at home, but that can be another good option. If you only have the one ball, what you might do is just put it on one side and move around there, or I like to rest my head and just gently move side to side, and I find that actually gets into the muscles a bit. The ball is still on the one side, not in the middle on the spine, just in the muscles. So I'll do one side, then I'll move the ball over to the other. I've personally been having a lot of tightness around my neck lately and been giving me headaches. So I find this one really helpful for that. There's a few variations. You can even support your head slightly with your hands like that. Just have a play around, whatever feels good to you. So you might do it on both sides, then move it slightly lower in the neck. It's a bit harder to get to the lower parts, just to get that pressure down, but have a play around. Then what I like to do, just kind of where the shoulders and neck joins, where there's this big muscle here, I like to get in. There's a point on everyone that's usually quite tight in there. So I like to put the ball there and kind of lean into that. And quite easy to find, for me anyway, but have a move around. You're aiming to find something a bit tender and just either move around or just sit there and wait for it to relax. So the goal of this is we're massaging it out and essentially tricking our muscles to relax. Often the tightness is just a result of the overactivity of the muscles, so they're just really holding on. That can be through a range of factors: an injury, stress, lack of movement, amongst other things. And do the same on the other side. All right. Now the spinal area, that's when it's good to have the two balls, because you can place the ball, kind of lean back onto it, and then move it slightly lower on the spine. It's a lot harder doing that with one ball because it really just hits one side really hard. The other way you can get into that part is just with a foam roller and just rolling up and down. With the ball though, you can get a bit into the lower back, so just from the spine off to the side, that big meaty muscly area. That's our quadratus lumborum. That often gets really tight, so you can leave the ball there and even just gently move around there. If you have a particularly sore, irritable back, I'd either avoid this, chat with your healthcare professional first. Might move it around a bit as well. Be careful not to go too hard on this one. And the same on the other side. If you find particularly tight areas or really beneficial spots, you might want to pause the video and just do it a bit longer by yourself through there before continuing on. All right, stopping there. Now glutes, your bum muscles, they're always quite tight on most people. So with your ball sitting on the ground, you can do this on a chair as well, but just lift one side and then sit through there and you can rock around through there. Now you can make it even more intense, gives you better benefits, but is also a lot less comfortable just by bringing, if you're getting into the right glute, so the ball's under my right bum, I'll bring my right ankle across the left knee like that, and that just really opens up through the hip, allowing you to get that bit deeper. As I said, a lot less comfortable. So move around, explore throughout that hip region, getting out any tight areas. If this is too much, just come back to both feet on the ground. So with this, you're also using your arms and this foot to support yourself, so they can take some of the weight if it's too intense, or if it's quite comfortable, you're using them less, more weight through the right hip. Switching sides, get into the left hip, once again sitting on it through the left hip, left ankle across the knee or foot on the ground, whatever variation you're wanting to do. Just move around, find some tender spots, try to release them a bit. Another reason you might not bring this ankle across the leg is if you have any knee or hip issues, in which case you might just be more comfortable doing it like this, or doing it in a chair, so sitting on the chair and then just putting the ball under your glute and moving around. You can also bring this ankle across the knee in a seated position as well. Stopping there. You can get into your hamstrings a bit as well. So if you're tight through the back here, you just put the ball under there, you press down and kind of move back and forward. So there's one way you can get through there. I always find this a bit difficult to get in effectively, but some people might find this one beneficial. Doing both sides. Good idea, even if one side's stiffer, that you do try to do both sides. Loosen up through both sides equally. You can bias it a bit more by rolling your leg inwards or outwards and moving the ball. You can hit different spots. So yeah, personally I don't find that one as effective, but have a go. If you find it helpful, use it. The calves, this is where we're often really tight, can be usually quite painful. So same position, you just put the ball there, calf down, and just rolling around like that. Oh, I'm quite tight through the outside of my calves. So I'm going to work through there, try to loosen it up a bit. So do this one if you have ankle or foot problems, but also knee issues. Or even just as a general loosen up. Probably work on this one all day, I reckon. And doing the same on the other side. It's not quite as tight for me on this side. And it is normal to be tighter on one side than the other. We all have our slight differences. You can even get right behind the knee. So just at the back of the knee where it creases, there's a small muscle there which can get quite tight as well. So you just put the ball there. I'm pushing down with my leg into the ground and just gently moving it around a bit. One that I really like that feels nice is getting into the arch of your foot. Often quite tight through here, especially if you've got a history of plantar fasciitis or any other foot problems really, or even calf tightness. You can get quite tight through there. So this one really loosens up through there for me. It also kind of relaxes me just in general, makes me feel a bit better. This one I find easier standing. If you need to hold on to something for balance, you just put that under one of your arches and roll it around. And once again, you might find particular areas that are tight. You can bias through them if you like. You can get into the sole, the heel of the foot a bit as well. So if I'm standing all day or been doing lots of walking, this one I find at the end of the day just helps me really relax, feel really good. And the same on the other side. Right. One other spot I forgot earlier is just getting through the front. So you can get through the quads a bit, like that. Oh, very common tight area. Once again, just really moving around lots, covering all the different areas of the quads, rolling around tight spots. Getting through the quads can take a bit of pressure off the knee joint as there's less pull or compressive forces behind the kneecap. So this is quite a good one for that. Can help try to reduce your knee pain just a bit, depending on what's causing the pain, of course. And then even up in the front of the hip. So if you find that really bony point just there, and then come just under that, there's a bit of muscle there, just off to the side. You place the ball there, and you can rock around on that spot. This is often also quite tight with when you have issues with your hips or knees, or just everyday general tightness. And do the same on the other side. So find that bone that sticks out at the front. You come just a couple of centimetres, a few centimetres below it, and then slightly out to the side. There's a nice kind of meaty area which you're getting into there. As I said earlier, you're not wanting to go directly on the bone or the joint. You're just getting into the tissue or the muscles. It's soft tissue work that we're working on today. All right. Yeah, feel nice and loose after that. Ideal scenario, if you have the time, what I would suggest after doing this is you try and consolidate it. So if you loosen up, then just go back to what you're doing, it'll just tighten up again. So ideally after that, you then want to stop, have a bit of a stretch. You might do some basic exercises, so working on your deep squat, for example. Just try to use that new range of motion, even if it's just around the house doing chores. But yeah, I'll leave you with that today. Have a bit of a play around. As I said, if you find any helpful, use them. If you find any useless, don't use them. But hopefully you're feeling nice and supple now.